So today I want to mobilize the sigmoid colon. So the best way to find the sigmoid colon is you're going to find ASIS, so that prominent bone right in the front, and then that sigmoid colon sits essentially right where your iliacus is. And so very commonly, people with hip impingement or QL, psoas type of pain right in this area can actually be correlated to dysfunction along the sigmoid colon. So what I'm doing here is I'm just finding his sigmoid colon right here. So I would call it about an inch to the medial aspect of his ASIS. And I'm just lightly pulling superiorly, laterally, medially. And so typically what you'll find is a superior pull is going to create a lot of tension. Now, he also has a history of an old surgery in this area. So for him, there's just a lot of scar tissue in general. So when you're working around old scars, like a C-section scar, a hysterectomy, a hernia repair right in this area, just be careful that you're not going too much over the scar, over the mesh with an inguinal hernia repair. So from here, I'm just scooping my hand directly superior, and he's going to do a left heel slide. Nice and easy. Good, and then back. Now, it's important to communicate with the patient while they go through this, so keep going, and just making sure that it's not uncomfortable or anything. And so I'm just keeping constant tension on his fascia. I'm not pushing my fingertips in too much, and he's just going back and forth with his heel. And so what we also could do in this area is he could do right knee rockers. That brings a huge pull as well. Is that okay? Okay. And so we can go back and forth like that. I could also ask him to do an anterior posterior pelvic tilt. So I want you to just arch your back a little bit. Keep your butt down while you do it though. Good. Relax. And just back and forth. And so posterior anterior pelvic tilts can also create a lot of fascial tension, especially on the lower aspect of the viscera.